Me karakia tātou, whakatakatia hau ki te uru, whakatakatia hau ki te tonga, kia mā kina kina ki uta, kia mā taratara ki tai. E hi ake ana te atākura, he teo, he huka, he hauhu, tihei, mauri ora. Tēnā koutou katoa, he mihi mai aha kia koutou. Welcome back to our webinar series. I'm Moira Clooney, I'm project lead for Te Ngākau Kahukura, and really stoked to be welcoming you back to this third and final webinar in our conversation series about trans health and primary care. Lots of you have been with us through the series. Some of you are just new with us today, but so as a lot of you will know by now from watching our previous sessions, this series came out of a really present and long-standing and ongoing conversation between ourselves at Te Ngākau Kahukura, Gender Minorities Aotearoa, the Professional Association for Trans Health Aotearoa, and the University of Waikato's Trans Health Research Lab, the team that conduct the Counting Ourselves study. We're really pleased tonight to have our guests here from the Counting Ourselves team to share with us some insights from their data from their last study and how it can be used to improve health services for trans and non-binary people. This series also feels like it's part of a wider conversation about how GPs and how primary care can support trans people across Aotearoa. In the last session, we heard from 3 GPs who are working really actively in this space and who've really taken a leadership role in their respective services and regions. And GPs around the country are thinking about this more and more. And this year also, the government has put some money for the first time into trans health and primary care. We know that Te Whatu Ora Health New Zealand is starting to look at how that money is used. So that's really exciting. And we hope that this conversation series is an opportunity to talk about what we think is most important with this work, what some of the gaps and issues are in primary care for trans and non-binary people, and how we might all be able to work together to increase access and reduce barriers to care. And this conversation is also really relevant to the systems change work that we do at Te Ngākau Kahukura, which more broadly is about making Aotearoa safer and more accepting for trans and non-binary people and rainbow people as a whole. We're often advocating for better resourcing of the health sector, particularly for mental health and addictions work, for primary care, for sexual health, for suicide prevention, as well as in this space of gender affirming healthcare. We know how important it is in that work to have good data that we can use to support advocacy and education. And we've often used the Counting Ourselves reports and data for these purposes. So really pleased to have our friends here from Counting Ourselves today. But before we introduce them to you properly, I'll hand over to my colleague, Joey, who will tell you a bit more about this particular webinar itself.
Kia ora, Moira, thank you. Kia ora koutou. Just thanks for being here. Oh my gosh, it is a windy, wintry, rainy evening. Feels much later than 7 p.m. to me. So for everyone tuning in, especially if you've been part of previous webinars we've been doing in this series, or even if this is the first time you've joined, we just really appreciate your time. We know that this is potentially not a time of day or night that is most conducive to learning and thinking, but we are going to do our best to make this interesting, to make this conversational. You're really, really welcome to ask questions at any time and put them in the chat. But we want to acknowledge, we know that it's hard to do the work in healthcare at the moment. Most people who've registered for these webinars are people who are currently working as healthcare providers in some capacity. And that's a hard position to be in a pandemic. So respect to you, and we support the work that you're doing. We are here to do advocacy so that your work can be improved and you can have more resources. That's part of our kaupapa. So welcome, and please enjoy the ride. Hopefully this is a fun conversation. Our previous webinars that we keep talking about, we had GMA, Gender Minorities Aotearoa, some advocates in the first one. We had GPs from PATHA in the most recent one. And we've been talking about what is informed consent and how can GPs provide good gender affirming care just as part of their regular work. We do actually think this is quite relevant to a lot of people working in primary care, not just GPs. This is quite a relevant topic, depending, or you could be a receptionist, for example. That's actually really quite relevant to this. But one of the key things was that GPs and other people have said that having evidence and data that supports improving services for trans and non-binary people is really crucial. You know, that people need to increase access, to improve services, to create pathways. You might need funding, you might need someone to clarify the process. There's various things that either frontline providers or people working at a policy level need to understand about trans and non-binary health and why this is important. And Counting Ourselves provides so much great data for us, and we know how widely used that data is. So we are extremely delighted to have people here who I will let introduce themselves in a minute, joining us tonight. That's really a pleasure. So we know that the data is really important. We know that it's really useful. And the other thing I want to highlight about Counting Ourselves, and why this feels really relevant to Te Ngākau Kahukura as well, is that this is community-led research. You know, this is trans research led by trans people. That is a team of people who, whether they're trans or not, in fact, are genuinely connected and accountable to trans communities. And achieving that in the climate that we currently live in is challenging work, you know, and we need more of that. So please give, you know, big kudos to Counting Ourselves team. And also I know that they connect with a wide range of other researchers who are probably also trying to be community-led and accountable. And that's the kind of thing that if Te Ngākau Kahukura can support you in any way to connect with the right people, just get in touch with us. We are always interested in that. Okay, what else do I want to say? On a practical note, this is going to be a short presentation in a minute, and then there'll be some questions that we're just kind of going to conversate with each other, ask each other and answer each other's questions. And also we might have things come through in the chat, which would be amazing. So if you have comments, if you have questions, even if you feel awkward and strange about maybe you don't know quite the right wording of exactly what you want to say, we will extend the grace needed to make sure that we can reframe anything we think needs reframing. We will love any input that you want to give us, because that helps us guide the conversation to make sure that it's useful to people who are actually here tonight and probably to people who will be listening later. So please put your comments, questions in the chat. We have Jono, our colleague from Te Ngākau Kahukura, monitoring the chat in there. And we also have Kyle Tan from Counting Ourselves in the chat, available to answer the technical data questions, because some people really like to, you know, go full nerd on the data, and Kyle is there for you. If that's where you want to go, you can. The rest of us will just be like the chatty ones in our little chatty boxes. Moira, are there any other considerations we want to mention starting things off?
Yeah, thank you. I guess in terms of comments and questions, I'm just thinking about confidentiality. As we've said in previous sessions, really important to make sure if you're asking questions or adding comments that you're not sharing identifiable information about particular people. That's especially relevant if we're thinking about quite small populations like trans or non-binary people. So if you're thinking about somebody that you're working with, or if you're thinking about a family member or somebody that you know, just maybe try and frame your question a bit more generally, so that it doesn't share anybody's personal information. And we do, as Joey said, welcome questions at any time through the presentation. We'll be having a look at them as we go along and recording them. So don't worry if we don't get to them immediately. And also, you're welcome to reach out to us after the webinar for more information. We've got tons of resources up on our website linked with this webinar series, as well as a gender affirming healthcare page that has more sort of resources and background and policy documents and all sorts of things that you can read, as well as links
really
through
exciting stuff.
Exciting stuff, as well as links through to support services if you're looking, if you're supporting somebody or looking for anything for yourself and looking for just places to start. As well as recordings of those previous two sessions that are part of this conversation series. So you can go back and watch those on our website or our YouTube channel if you're interested. I think that's everything I had to say.
Cool.
Joey, kia ora.
I will
back to you.
Say that I'm delighted to have Jack Byrne and Jamie Veal and Kyle Tan with us today. to set the scene, I know them fairly well. We've worked together quite a lot over the years. And one of the things that we really love about Counting Ourselves and Jamie and Jack and Kyle is the rigorousness and the relevance of your work. You know, you are here and you are bringing the integrity when you do it. So thank you. And thanks for being part of this conversation. Looks like Jamie is unmuted. Go right ahead.
Tēnā korua. So yeah, I think it's my turn to introduce myself. But yeah, just first, I just want to say a massive mihi to you all of the Te Ngāko Kahukura folks, those two of you who are visible and hosting, and those in the background as well. Not just for this webinar, for just putting on such a wonderful series. So yeah, I think we're all so much richer from the diversity of perspectives. So massive thank you to you all for that. Tēnā koutou katoa. Ko Jamie Vialaho. I use she, her pronouns. I'm a senior lecturer in psychology and a Rutherford Discovery Fellow at the University of Waikato. I'm a Pākehā trans woman, and I'm also the co-lead researcher along with my colleague here, Jack Byrne, on the Counting Ourselves project. I'm also the president of the Professional Association for Transgender Health, Aotearoa. You've probably heard a little bit about this on your other webinars, or will at different points. So we're an association for all people working for trans health in a variety of spaces, including like academic settings like myself, but then community, clinical, even education, legal settings as well, and whether in voluntary or paid capacities. Yeah, I think that's enough about me for now. I'll also, before I go on, just say that I'm on day 7 of a COVID journey, I guess. Infection sounds like a very clinical word. So yeah, I'm feeling pretty good overall, but I think I'm sounding a bit throaty maybe, and bear with me if I'm not 100% onto it.
Kia ora, Jamie. Thanks for speaking first. As the director of our Trans Health Research Lab, I remember when other people have visited, other researchers from other parts of the world have visited us at the University of Waikato, they've just loved the idea that there is actually a Trans Health Research Lab, even if it's not much bigger than a closet. But it's great to have it. Called Jack Byrne aho. I'm the senior researcher, the co-principal investigator of Counting Ourselves. I have a background as a senior policy analyst as well, working on trans health and human rights. I was at the Human Rights Commission for 9 years, and I'm the co-chair with Moira of the PATHA's Policy and Advocacy Committee. So, write submissions and do things like that. It's great to be here.
It's lovely for us to have you all here. And Kyle, feel free to intro yourself in the chat if you feel like that's what you want to do. I will let you kick off with slides and we'll do this presentation and have some question and chats afterwards. Again, audience members, please, questions in the chat. We love that. Thank you.
Kia ora, Joey. How are those slides looking, folks? Great. Okay, so I'll be kicking things off, and today we're going to be talking particularly focusing in on some of perhaps some of the newer findings from Counting Ourselves of our although we're reporting on data that were collected in 2018, we have a couple of more recent publications out, which we're quite excited to share. So we'll be discussing that today. But I did want to also flag that we do go into much greater depth with hearing about people's trans and non-binary people's experiences in healthcare experiences broadly, and also in primary care settings in our community report, which is the main release of the findings from the 2018 wave of Counting Ourselves. So you can head to the Counting Ourselves website, or you can search for Counting Ourselves community report to find that. Yeah, so just very briefly a bit about Counting Ourselves. Joe's already mentioned being led by trans people, and yeah, we had a diverse community advisory group and kaupapa Māori informed research And we've, as well as getting robust and strong community input, we're also really focused on making sure it's relevant to policymakers as well. So being reviewed by a number of key stakeholders. And the data were collected in June to September 2018. So it was 4 years ago now. We had a total of over 1,100 responses. Not everybody filled out every question, but that was the number of responses that we could use. To participate, you had to be age 14 or over. You had to be living in Aotearoa, New Zealand, and trans or non-binary. I mentioned the community report that was released about a year later, and we're going to talk today about some of our academic journals. Yeah, the things that we're really most proud of actually is how well the data get used. So yeah, we're always keen to hear about how that has been successful, so that we can do more work in that space. And we're going to mention at the end that wave 2, which we're really excited about, of Counting Ourselves, is hopefully launching really soon. So yeah, we're going to touch on, this is a very brief overview of a couple of academic papers, which if Jack, myself and Kyle and some of our other colleagues, some names will be familiar to many of you, I'm sure, have done. So this one is looking at, focus particularly on supportive interactions within primary care doctors, within primary care from doctors. And so I guess the real headline finding, well, first of all, I'll just say a few things about these positive healthcare experiences. So we asked people, if doctors, including GPs, we asked people if their experiences with GPs had been, and we gave them a list of quite a range of positive experiences, which included things like being able to treated you the same as any other patient when your needs were not directly related to gender affirming care, being able to clearly explain why all examinations were necessary, showing that they knew a lot about gender affirming care. And so what we found was that those who reported these positive healthcare experiences, for every extra experience that they reported, they were statistically significantly more likely to report, to score more lowly on the scale for psychological distress that we had. And they also had a 10% lower odds of reporting having had a suicide attempt. So just before I go into this, I will say, I think one of the really useful and interesting findings is that, we found these effects even after we, I guess, statistically controlled for some of the usual things that we do in these studies, like demographics, like it didn't matter if it was, if there were any differences due to age or ethnicity, but also we controlled for actually having negative experiences as well. So what that really showed was, even for people who might have had negative experiences within healthcare settings, and it might have been, within primary care or elsewhere, that these positive experiences might still be really important, even after controlling for that. We did also note that there were some areas where we would have liked to have seen higher numbers. Only less than half of our participants reported that their GP was supportive of their needs related to gender affirming care, always used their correct names and referrals, showed that they were willing to educate themselves on gender affirming care, and using the correct gender pronouns. And then on to our second study. This was a mixed method study, which is forthcoming, hopefully, in the New Zealand Medical Journal. So in this one, we asked a question that was the same question that is asked in the New Zealand Health Survey, which we did a lot of questions in Counting Ourselves, so we could have these population-based comparisons. And in this one, what we did was so the Counting Ourselves study is the population is the sample is quite different from the general population in the New Zealand Health Survey, particularly with regards to age. So what we know is that, well, what we know from counting our cell sample is we had a much higher number of young people. We had over half of our participants were in our age 14 to 24 age bracket, which is a higher proportion than the general population. And given the type of study that we do, we don't know to what extent that is due to, you know, the way that we were able to, you know, it might have been easier to recruit people through things like social media, perhaps. But we also know from population-based studies that the trans population tends to be younger as well. So anyway, the reason I'm saying this is the analysis here, we actually changed the New Zealand Health Survey by age and ethnicity, so that these are directly comparable. So it's not just you know, due to people being and counting ourselves being younger, for example, that might explain these differences. So these differences that you see here on having different confidence and trust in the GPs that you saw, and doctor being good at or very good at explaining health conditions and treatments in the way that they could understand, and involving the participant in decision makings about their care. You know, unfortunately, we are seeing some inequities here and some statistically significant and meaningful inequities here as well. And, you know, these are obviously, because it's the New Zealand Health Survey, it's not about specifically about gender affirming care. This is about, you know, the general routine, could be about the general routine care, or it could be people have been thinking about gender affirming care. But even so, you know, people are having a different experience, an equitable experience here with their care. And we also looked at comparisons with the New Zealand Health Survey with cost and transport barriers. And unfortunately, we are seeing inequities here as well with counting ourselves participants being more likely to report cost and transport barriers again after we control for age and ethnicity differences. So yeah, in this article, we went into some more detail with some qualitative findings as well. So I'll hand it over to my colleague Jack to talk about that.
Thanks, Jamie, and thanks for being, for moving through the slides for me. So this was the mixed method looking at the qualitative comments. And so we analysed comments, as it said there, from 153 participants. They were asked, is there anything else about your experiences with primary care providers you'd like to share? And this is actually the title of, this first quote is the title of the article. And that's forthcoming in the New Zealand Medical Journal. So it's about, you know, I teach them, I have no choice. And I think that was particularly an issue for non-binary people. So this is the gaps in the knowledge. And in the next case, it's, you know, that, you know, if there's an open, accepting attitude, even if there are gaps in knowledge, that is really, really valuable. So it's that openness to learn and do it as a journey together. And also an acknowledgement about, you know, the current context of underfunding, understaffing, and a general lack of training. So, you know, people were realistic, but it was having a real impact on their ability to access care. And I think there's one more there. And someone speaking positively about, while there's, I feel that the level of transgender related training given to GPs is inadequate, I'm noticing that with their second GP that there was a difference. The next theme after that is around the importance of creating respectful, empowering experiences within primary care. So this first one is one like that. It's this person, my primary care provider respects me as a patient who is well informed and educated and involved with my treatment. Whereas when we move to the next one, like, I guess what I got from that, the next one is it's the difficulty for trans and non-binary people of how to start a conversation where they're trying to be assertive and convey that they know a lot with a worry, an underlying worry about will that impact on care. So I find I had to be very carefully and politely assertive to acquire medical care. We haven't included another quote here, it's in the community report, but it's about similarly someone really nervous about what they could say. In that case, it was a non-binary person who said that they never disclosed that specificity around their gender identity because that was the bit that they didn't think people would understand. Next quotes were, and this one is where the respect or the quality of care, the relationship is around the patient-doctor confidentiality, because this person is with the GP, they've been with their whole life, other family members are there, but they never at any time worried that there would be any break in that confidentiality. And so how important that was. And the third theme was around, I think we've already, Jamie touched on it right at the beginning, the importance of everyone within that clinical setting. So the impact of receptionists, even if, you know, even if the doctor is great, if the impact with the receptionist can have huge impact for people. And particularly, you know, when receptionists have access to NHI information, which provides a lot of information about a patient. And a couple of others, another one here where someone talked about changing your primary care provider. And part of it was for cost reasons, but it was also because they were uncomfortable with the care. And it wasn't just about the care from the GP, but also around, you know, generally about not being recognised in their gender. And this included being called by their dead name, by their previous name, by the receptionist and the nurse staff. So it's across, you know, receptionist, nurse staff and GP, those examples. And then the fourth theme that came out. So these aren't just random themes. Kyle, who did the analysis, did quite complex, you know, moving around of the data and checking for themes. So these are the fourth one was around access to care and the patchiness of it. So for some people, it's that access to free healthcare happens because at a certain age, they have access to a university service, which they will probably age out of. But without this, I would go to the doctors much less. And an example of someone who, because they couldn't afford it, couldn't take the medication. And then that last quote where people are someone's talking about, you know, Central Auckland, it can be easier. So but therefore, knowing that they are fortunate, and it's harder even in other parts of Auckland, let alone in other parts of the country. And we do know that some people, that we had other quotes in Counting Ourselves of people traveling really long distances to stick with a GP or find a new GP, or with the level of housing mobility amongst our communities, even if they shifted quite a large distance, still traveling back to an old GP because that's where they could get the care that they expected and deserved. I think that's my last slide there. Oh, we can do this now if you want. Yes, we'll do this now. So this is just, we've signaled, see the 2022 on the left-hand corner. This isn't going to be our new logo, but it's just to tell you we have a 2022 survey coming out. We had got provisional approval for our ethics application yesterday, just got some small things we have to do, you know, and so we're hoping to go live before the end of August. So and those are all the wonderful people who have the first three sponsors are people who supported. Jamie got a Health Research Council funding for our first survey, and we got some support from the Rural Foundation and a bit from the University of Waikato. But the big funding for the next wave, and we're going to do another wave after that, is from the Royal Society with Jamie's Rutherford Fellowship. And I think there's another click here, Jamie. Yeah. So live from late August 2022, there are new questions, including about the impacts of COVID-19. We've got some questions about people's experiences with home support services, experiences in aged care, and some intersectional questions for people will go to our website to start the survey, and we'll have all the information there, and we'll be doing a refresh of our website just before that happens. But you can sign up Now, anyone who wants to get the alert that the survey is about to happen, go to our current website and a little pop-up box will come up, and it just means that we end up telling you it's about to come, and then it's come, please fill it out. We know that many trans and non-binary people aren't linked into community at all, and that for many, a GP might be one of the people that who knows that they're trans. Not in all cases, you know, everyone will have, you know, many trans and non-binary people don't disclose their trans status to GPs, but often GP will be someone that someone has talked to about accessing gender affirming care. So we would love if health professionals, PHOs, health networks could help promote the survey in any way so that we can collect data that you can use. And I think that's going to be part of the discussion we have. If you're doing things electronically, we can give you social media tiles. Well, we will be able to by the late August. And if you like the old school flyers, we can give you those, and they'll have a QR code on them. So if someone's very discreet about their trans status who comes into your waiting room, they can just point their phone at it and look at the information later. But yes, would love you to be in touch, whether it's about the presentation today, anything else, but also to help us promote the next survey. Kia ora.
Thank you so much. I'm excited about the next round, even though also it's quite a long survey for those of us who are going to fill it out. But I look forward to the data at that point after it's happened. So yeah, exciting that your ethics came through yesterday, at least mostly to some extent, and that it's looking positive for a late August launch. That's so great. We will definitely promote it. And if anyone wants to get in touch with us to connect up with Counting Ourselves, we'll always do that. So yeah, we're all connected up. We've got a few questions that we thought were quite important to cover. And this first one, I'm asking Jack, and it's one of those like impossible, you can't really answer in every way that you would like. So asking for the more brief version of the answer to this question. We know that a lot of clinicians have been signing up, and not that that's the only audience who have signed up for these webinars, but are you thinking, based on the data you've got, that there are things clinicians could be doing differently to increase the chances that people will have positive experiences in primary care? Like what you just demonstrated is the importance of having positive experiences is so protective. So what do you think would help that happen?
Yeah, but some of it is, you know, the stuff I guess that any training package talks about, but it's also just about treating people with dignity and respect, and around names and pronouns, including, like, you may not use you'll probably use their name when you're talking to them in person. You may not use their pronoun then, but you'll probably use it in a referral letter.
Yeah.
And those things are really important, because that's then the ability to either affirm someone or to really discourage them from accessing those services if you use the incorrect details. And, you know, I guess I want to come back to the data that only 20% of Counting Ourselves participants felt very comfortable discussing that they were trans or non-binary with their GP. And when it was a new GP that they saw, that drops down to only 5%. So it's like anything that people can do to increase that level of comfort by displaying respect, by being upfront about what they know and don't know, the openness to respecting the knowledge that someone brings in the room with them, learning about your own local gender affirming healthcare pathway so you can make referrals, you can help people navigate access, and you know, listening, responding with information when you're having, and also writing letters of support. I think on the Patholist is a great place where people share good advice. And one thing that came through today was someone wanting to know, you know, they've been asked, could they write a letter of support so someone could access their KiwiSaver fund, and others jumping in and saying, yes, as a counsellor, or yes, as a GP, or yes, as another type of health professional, I've written that letter of support for someone so that they could access that for, in this case, it was for top surgery, chest reconstruction, but people have also accessed it for lower surgery as well. So
Yeah.
all of those things, yeah, there's
Right.
some examples.
Such a mix of like practical, immediate, and like interpersonal, relational. It's okay that people will get things wrong. It's about demonstrating respect and recovering from any mistake, you know, graciously and swiftly, not forcing other people to deal with your distress about having messed something up. It's okay. It's okay to make a mistake. It'll be all right.
Yeah.
You know, we want people to feel like they can learn. Yes. Okay.
Yeah, and I think like so many of those things that you're describing, you know, do sound like they're so simple, like things like getting somebody's name right or using the pronouns that they want you to use correctly. But I think some of the real value of the Counting Ourselves study has just been how you've been able to really demonstrate the importance of that with numbers. You know, like these things might be quite small, but they can make a huge difference in terms of people's well-being, people's trust, and that sort of relationship with doctors or with the professionals that they work with. So yeah, thanks for that. I had a question for Jamie, if that's okay. Super exciting that the next wave of the study is coming out soon. I wondered, do you anticipate there being much difference between the data from 2018 and what you think you might see in this year's survey when that's all complete?
Thanks. Yeah, that's the big question. I mean, I guess that's why we're doing the research. Yeah, and look, you know, we know there's a lot happened. There's a global pandemic, you know, and thinking about things like, you know, some of the, which we haven't talked about, you know, overall levels of inequities for things like mental health. You know, we do worry about things like, you know, greater levels of isolation. And there might be some more challenges there. And, you know, also delays in accessing surgeries that might be related to that as well. But look, yeah, I think what's probably more relevant to talk about here is, you know, primary care findings. You know, that's what we discussed as well. And yeah, look, I don't know. I guess one first point with a lot of this is, you know, I'm sure a lot of people who are like perhaps, you know, more closer with communities like you, Moira and Joey might know more about, you know, what you're hearing and about how things are. So you might be able to say some things. But yeah, I think when in the primary care space, you know, I'm actually, you know, quietly hopeful that we will be seeing, you know, better numbers with some of those percentages that I reported. Yeah, like people feeling, you know, having more of these positive experiences and fewer of those negative ones. I think there has been a real push for, you know, a real awareness raising by, you know, part of it's been done by great groups like the groups who've been in this webinar series, helping to push for it, and also a number of GPs themselves electing to stand up and be real leaders and really pushing really positive care and actually, you know, getting out there and showing that, hey, it's, you know, it can be done and this is the way to do it. So yeah, I'm my money would be on some of these primary care experiences looking a little bit hopefully improved. Got my fingers crossed.
Yeah, thank you. I think being kind of closer to the ground, definitely anecdotally, would say that there's a huge amount of kind of interest and understanding about how important the issue is, and also real gaps in the training and education that's available for people in some spaces. So it'll be interesting to see at that population level when the Counting Ourselves results come through, what you find there. Are you, in terms of your work with PATHR as well, are you seeing any changes or improvements in kind of policies or other system changes like within government that we can feel hopeful about?
Yeah, so I didn't directly, but some of our PATHR colleagues looked at, well, for both of the symposiums, we had one in 2019 and then in 21, looking at, you know, what other services that were available in DHBs in there. And, you know, we can look at the list and, you know, there are some improvements, but there's still some real massive gaps. And look, where the pathways are, there are many of them are actually oversubscribed as well. So we are hearing that there are things like, you know, referrals no longer being accepted, or, you know, long waiting lists. Yeah, and I guess the other challenge, obviously, we're hearing as Jack mentioned before, that healthcare system is just struggling in so many ways with so many things right now. So that's why I think it's just so important, which PATHA has always been pushing, to make sure that this type of care is well resourced, fully resourced as well. It's just so important that you know, for example, if there are longer appointments that might be needed for something like initiation of gender affirming hormones, you know, we would like the government funding to be so that, you know, there wouldn't be a need for a co-payment, so that it just really makes it so much more equitable for people to be able to access.
Yeah, thank you. I think that affordability is a really huge issue for a lot of
Yeah,
people.
I might have gone off topic, but I think, yeah, it was still.
You're on it. You're on it.
You're good.
It's a big topic. We have a question in the chat that I thought might have a pretty short answer about, are there non-digital ways to complete the survey? Because if you're trying to get people who are maybe older rather than younger people who are more likely to be connected online, does Counting Ourselves have a way that we can do that? Jack's nodding.
Yes.
Yes.
Yes. Yes. So what there are options for paper surveys,
Cool.
so people can get in touch with us, including via phone, and have it still be anonymous. So you get the printed out with the stamped self-addressed envelope. So there's no cost for you for doing that.
Great. So just get in touch with Counting Ourselves via their website if you are wanting to share that information, and yeah, they'll help you out with that. I wanted to ask, oh, Jack.
I was just going to say that we've also had support from last time our community advisory group. So people who were on that, who were really, really helpful in helping get the information out. Like I think Laurel, I don't know if she's on this call, but I know she was registered for it. Really, you know, collected copies of the survey and took them around to people who wanted to fill them out by hand down in Ōtepoti down in Dunedin. So, and we're also this time really wanting to, if there are people with disabilities who need some support in filling out the survey, where I think it's going to be on a case-by-case basis. We're going to try and do our best to enable to find someone who can work with someone to do that, whilst trying to also maintain the anonymity of the survey.
Mm. You're getting a lot of positive feedback and compliments in the chat, which I don't know if you can both see at the same time as we can, but it's people saying that they're using the stats and using the information that you have to great success. So one of the results that I think we all have heard about and are really celebrating is the Nursing Council including all diverse genders and sexualities in priority 5 of their new strategic plan. So credit Mel. And that's what we want. That's really what we want. You know, we want, I know Counting Ourselves wants this, and also Te Ngā Kaukahukura wants this. We want to try and make ways for people who need to do advocacy to an institution or an agency or a professional body to have access to the information that would enable you to do that. And certainly, like, obviously the data at Counting Ourselves is really important, but if anyone ever needed any extra eyes looking over anything, that's the kind of level that we would love to work at. Moira and I have, and Jono have a fair amount of experience in that kind of advocacy work, so please get in touch as well. Cool, beautiful. I'm thinking about informed consent being such a key theme across all of these webinars, thinking about the barriers that you've mentioned people facing. Some of them are to do with cost and transport rather than the way healthcare is delivered. But Jack and Jamie, both or either of you, do you have thoughts on how using informed consent models of care for gender affirming care in general will enable better access for trans and non-binary people? It's a really current topic that it gets defined differently by different people. So any thoughts on that?
I think one thing to say would, you know, it brings conversations about health back to the person who a trans or non-binary person is most likely to see most regularly, their GP. So sometimes we define informed consent negatively in terms of what it avoids. It avoids pathologization, it avoids assuming that people always need a mental health assessment before they can access care. But I also like to see it in a positive way. It empowers conversations with the person who is best placed to support you in the most affordable way, close to home, in a holistic way around all aspects of your care. And it can be an evolving conversation and an evolving learning process for people, because the actual, especially when you're thinking about gender affirming healthcare, the actual services that people are and the pathways are evolving as we speak. And we all have to be on our toes. We see a gap, and then because there's so much demand, as soon as the door opens, it gets flooded and it shuts again. So we all have to be on our toes. And the information is evolving. The new standards of care will be out in the next couple of months. Let's be on this journey together in a respectful way.
Yeah, talk of that, Jack. I'd just say, yeah, I agree. It's important for improving the health of trans and non-binary people, anybody who might be wanting to access gender affirming care, in so many ways, reducing the barriers. I think also the importance of bodily autonomy. That I know, particularly Rebecca Nichols in the last webinar talked about. It's empowering to people to be able to be making those decisions for themselves about their bodies, and I think that's important for our health.
100%. And even if there's some debate, I mean, that's partly why these webinars are a conversation. Different people have different perspectives and different professional backgrounds about how they would interpret what an informed consent model is. But even if there's a level of I guess uncertainty, or still definitions still being worked out and the details of different pathways being worked out, that underlying principle of like respecting bodily autonomy and self-determination feels like such a fundamental thing that we can keep falling back on. So I'm pleased that the discussion is often centered around that, even if it also involves other considerations that are sometimes to do with funding or just how things have always worked like this, and it's hard to change how things have always worked. But we're getting positive changes are happening. So that's...
And we've also got the ability here, I think, in Aotearoa to make change quite quickly, and to do it in a way that is relevant to Aotearoa and health models that are Indigenous to this country and this region. And I think we can play a leadership role, and Jamie's funding also is going to uncover an international study around informed consent, around access to gender affirming care. And many of the people in countries that we're likely to be working with, we haven't finalised that yet, they're facing attacks on sexual and reproductive health and rights. This is a time where, offering positive framing of bodily autonomy and linking some of those struggles and coming up with solutions are really important. So I think it's, I'd love to see Aotearoa leading on that in that area.
Completely agree. We have a question here from someone about recommending good books and resources to help health professionals improve their understanding. And I know Moira's just popped in the chat the gender affirming healthcare page from our website, which is one of the places that we've kind of curated lots of key pieces of information. There's a section there particularly for healthcare providers. That's a good place to start. And obviously going to the Counting Ourselves website, you'll find their publications and research relevant too, but that would be less about influencing your practice maybe. Great. Oh, I can't believe it's 7:49 already. We had so many things we were going to try and cover, and of course you can't get through everything. So I mean, Moira, is there any key question that you were really wanting us to cover at this point, or any other point? Or Jamie or Jack, do you have any particular questions for us? Conversational.
I wondered about, to give you a chance to answer a question, because you do a lot of training at Te Ngākau Kahukura, and like especially around receptionists and admin staff, who I'm guessing are under huge time pressure as well and don't get a lot of access to training. Like, so, just any thoughts about how, to support them in their, learning and development in their role?
My main thought about it, and Moira, I'm interested in how you want to weigh in on this, is that if it's easier to get training or professional development for your clinical staff, and the receptionists and admin are not considered clinical staff, then as a clinical staff member, please advocate for the necessity of your receptionists and admin staff to get their own session as well, because often if they're saying, oh, we'd really like to join, someone will say, yeah, but who's going to cover the desk when you're gone? It's harder for them to be released. And it will make a difference if clinicians are saying, hey, I've heard from my patients and from the Counting Ourselves research that receptionists and admin staff are really important for providing good care. And there's a lot that we could be doing better in that area. So I would love to see our receptionists and admin staff get access to some information. So that has worked. We have done sessions particularly for admin and reception staff, and have found that is a different angle. That's something that's really important and often neglected.
Yeah. And I was thinking back to that workshop we did in Christchurch with admin staff at one of the PHOs down there, Joey. And I think one of the key points that you brought across for them that I keep remembering is just talking to them about ways of working within imperfect systems, because often even if a receptionist does have a lot of knowledge, maybe has some trans friends, maybe is trans, maybe kind of knows the language, has the competence, knows how to use someone's name properly, they might still be working with computer systems that are imperfect, or the form they get people to fill in might have a really good inclusive gender question, but then when it comes to actually putting that into the computer's only still got 2 options, and you have to kind of decide and choose which one. And so a lot of the skills actually are also about what do you do in those situations. Like if you're having to choose between a male and female box and choosing which one to tick, how do you respectfully talk to the person about that and explain what's wrong, and be able to acknowledge that it's not perfect, and help the person to make that decision with you in a respectful and empowered way, and maybe not have that conversation in front of a full waiting room kind of thing. And so it's some of those sorts of skills. It's how do people work with people respectfully within the system that they're working in.
Thanks for asking us a question.
And I think that, for cisgender people, questions about your gender, probably doesn't feel that private, but it is really private information for trans and non-binary people, and should be accorded the same privacy as other clinical information.
Yeah, particular safety concerns for some of us, quite relevant to think about. We have more questions coming through than we will be able to answer, but I know at least a couple of them we will be able to follow up on after this, and we'll get back to you. We've got ways of doing that, and we're happy to respond further. So please don't feel like just because we'll not be able to get through it all now that you're not having an option. We're certainly keen. Is anybody feeling like they could spend a couple of minutes talking about screening programs? There's a question here about GPs and primary health. This is a very current concern in lots of cases, right? Trans clients, you don't want to miss the relevant screening. But if you're screening for a cervix, cancer of the cervix, or you're screening for something to do with prostate, and your system is lining it up as this must be a female tagged person or a male tagged person, how do we respond to that?
Yeah, the example that's in the chat is even trickier than that, because it's around breast screening and mammograms, and those might be relevant for some trans men, they might be relevant for some non-binary people, and of whatever sex they were assigned at birth, actually, and also might be relevant for trans women if trans women have been taking hormones and have developed breasts, they need breast screening as well. And so that's where these computer systems are just completely inadequate. There's not even a binary option you could choose that would make sure that somebody could have their gender respected, as well as being tagged to receive the right kinds of screening. So, you know, really we need computer systems that can record what kinds of screening people need separately from whatever gender is tagged into the system. You know, I think doctors, you know the healthcare needs of their patients better than a computer does. And we need to not be kind of leaving it up to a computer to just decide what people need. So it's not an easy answer, because really some of the computer systems that some GP practices use are just really inadequate and don't account for the existence of trans people. But we do need to have some workarounds so that we're asking, you know, does this person need regular mammograms, rather than just asking what gender they are and making assumptions based on that.
And I guess if you're wanting to have an open discussion with a patient or client, then that's the most important thing, is to create an environment where someone knows that their gender will always be respected. So, you know, we know enough stories of people getting sent information with the wrong pronoun because of how they've been alerted through a screening tool. Yeah. And so creating an environment where people know what we're talking about is that you may have certain tissue that needs to be screened. And so you're a man who may have that tissue. You're a non-binary person who may have that particular tissue, or you're a trans woman, a woman who has that tissue. And it starts from that place. And some of that similar stuff we talked about before, up-to-date information, because some of the community knowledge and some of the clinical knowledge has changed over time. So how we can share that information, because sometimes there's been an absolute lack of information, for example, around trans women and and breast screening. And in some other cases, there's been an assumption of risk. So we're so under-researched that we can't always rely on having a lot of evidence-based data in every particular area. So it's creating trust so that you can have a conversation with someone about what we know generally and what are your risk factors. And if someone doesn't trust you enough to tell you they're trans or non-binary, you're not even going to be able to start that conversation. So it comes back to trust.
Yeah. And acknowledging the harm that can cause when somebody gets sent a letter that seems like somebody's totally misjudged the gender that, so if you can say, and this is something that some people may not consent to for this reason, if the letter is going to be women's health, women's health, women's health, women's health, and this person doesn't identify as a woman, and that's quite stressful, you can imagine they might not opt to get screening that comes with that level of gendering. But there might be some people who, if you said it's really unfortunately limited at the moment, this is how it gets framed, and I'm really sorry in advance for any bizarre content that you get sent on this issue, some people might be able to flex with that. I'm not guaranteeing it, and I'm not saying that everybody should, because I think that's fair to say, no, the system should change actually, but some people will be able to understand how that goes, that it's, you're trying your best, you have a trust relationship with that person, and the system is not adequate yet. Yeah.
And I think I couldn't gather from the questioner what role they have in the screening program, but I think also if you have a role of influence, I think it's important that there's good information for clinicians, good kind of guidance about working with trans people on that particular program, and good patient-facing information. So people can even understand that whether they're eligible for something, whether screening is relevant for them, because when it is all kind of languaged around, this is a women's health thing or a men's health thing, it can be really ambiguous for people who are trans or non-binary, or where it's not quite as simple as just that binary option.
And now we have 1 minute. We will leave it there, and I just want to thank our speakers and thanks our audience for being here on this stormy night. We so appreciate it. lots of resources on our website. Please go to Counting Ourselves and follow them for information about the upcoming new survey that they're going to launch. We will also be sending out an evaluation form for covering all of these webinars, all 3. So people who attend this one, but also we'll send them to people who've attended the previous 2. We would love to hear your thoughts on how you think these have gone. They won't be long surveys, I promise. And we'd like to thank the Rural Foundation and the Rainbow Wellbeing Legacy Fund for their support of this webinar series. I should stop talking. Moira, I will hand over to you to close us with karakia since we opened that way.
Oh, kia ora. Thank you, Joey. And thanks again, everybody, for being here. This link at the bottom of the screen is to our webinar section where you can find recordings of the previous sessions and more information about what else we're up to, as well as links to everything we've talked about tonight. But I will just close us with a karakia and let you get on with your evenings. Me karakia tātou. Unuhia, unuhia, unuhia ki te urutapunui, kia wātia, kia mama, te ngākau, te tinana, te wairua I te ara takata. Koe ara e rongo whakaere ake ki runga kia tina, tina. Huie, tae kia. Kia ora koutou. Thank you, everybody.
Kia ora. Pō Māori, everybody.